about breast cancer.
Boobies!
It's Breast Cancer Awareness Month, and so this is a really big deal that there's more awareness about this, and there's more research. What's happening now is more people are living after cancer. So we have more survivors.
Yeah.
We have more people going through treatment and living nice, long, healthy lives after cancer than what we used to. And the problem is, and what we're talking about today, is sexuality in the aftermath of breast cancer, ovarian cancer. You know, the three most common cancers that will affect women and girls: breast and uterine and colorectal cancers. And all three of those can have pretty major impacts on genital organs, sexuality, overall well-being, just feeling sexy. And so sexuality is something that's really takes a hit in survivorship, and so a lot of survivorship clinics are employing sex therapists or sex counselors like myself to talk with these people as they survive.
And I'm so happy you bring that up, because no one really talks about the aftermath after you survive. How do you pick up the pieces and start over? Yeah, and so I'm glad that we're going to touch on this. So where do we begin?
Well, it's me, so we're going to begin with sex.
Of course. Well, I don't even know why I asked that question.
The treatments that we use to save lives, so the chemotherapy, the radiation, surgery, those all affect sexuality. So there's the chemotherapeutic agents will often will try to put women into a menopausal state because that takes down their hormones. And a lot of these cancers, not all of them, but a lot of them are hormone receptive, so receptor positive, so estrogen receptor positive or progesterone receptor positive. And so we want to just kind of clear as many hormones out of their systems as possible.
So they lose their sex drive.
So they lose their sex drive. So you hear about menopausal women and their sex drive can drop because their hormone levels change. Well, we can just supplement hormones with that. And in breast cancer patients, they don't have that luxury. But there are relatively easy treatments that we can do, that we can implement to help some of the physical changes that happen after cancer as well.
Such as what?
So if a woman has had some sort of estrogen or progesterone receptor positive cancer, say a breast cancer or an ovarian cancer, and we have to take away all their hormones. So then oftentimes the vagina, insert vagina, gets all dried up. Right? Kind of like after menopause.
Yeah.
But if they had radiation, so after a colorectal cancer, also this will happen. They get scar tissue. So this hole, I don't even know if I can do it, but this hole, the vaginal opening closes up.
Wow.
So there are some times where you can't get even a pinky or anything in because there's scar tissue that scars around there. And if you try, it tears and it bleeds and it's terribly painful.
Well, what about going back to those, like when we did our sex toy thing, you had those medical toys. They weren't for pleasure.
They were dilators.
Were the dilators,
Glad you remembered that.
Yeah, or do you subscribe, do you...
I subscribe to dilators and I also prescribe them.
That's what I meant. Prescribe the dilators to cancer patients.
Dilators can be helpful. They often have to be started prior to this, right? Because once they're here, I can't hardly get anything in there. So dilators can be very helpful. I talk to all my patients about massage and vibration. So just bringing blood flow to the area. So I talk to them just simply about how to massage the vulva, the labia majora and the labia minora, and how to basically take that tissue and pinch it between your thumb and your forefinger and bring blood flow to that area.
And this is all, you recommend all this while they're going through the treatments?
If I can get, if I can get to them, or if they can get to me during treatments, then yes. If not, after is okay. But yes, during the treatments, if you can bring massage that brings blood flow, just like if you massage your neck.
Yeah.
That's the point there, is to bring blood flow to an area that's injured, and that blood flow helps that tissue heal. The other thing that we can do is sometimes we can use estrogen. Take a little bead of estrogen on the tip of your finger and just kind of rub it here. So that satisfies not only the massage, but also some estrogen. Now, cancer patients, typically, if they're estrogen receptor positive, they're scared to use estrogen. A lot of times the oncologists don't want them to use estrogen.
How come?
Theoretically, if we increase the levels of systemic estrogen, we could increase their risk of recurrence of cancer.
Oh, wow.
And their recurrence of cancer may not, so if they had breast cancer, their recurrence may come somewhere else. It may be in their bones. What we do know about these low-dose vaginal estrogens is that the systemic absorption is very minimal. Our moisturizers that people can use also. It's just like putting lotion on 4 or 5 times a week if you're a cancer survivor, and that helps just kind of moisturize and replenish the tissue. So between the moisturizer, the massage, the vibration, possibly a vaginal estrogen or a vaginal DHEA. And then now there are vaginal lasers that can be used that are really showing some really good promise with cancer patients especially.
What does a vaginal laser do?
Well, it does this. You can go to the bar later and say, I just had my vagina lasered. What'd you do today? There are a few different types of vaginal lasers. The one that we have in our office combines 2 different wavelengths, and the 2 wavelengths create more collagen and more lubrication in the vagina. So it essentially does what vaginal estrogen does without the estrogen.
Without the estrogen, okay.
Yeah, so they're phenomenal treatments. They've been around, of course, in Europe
And insurance covers it?
Nope.
Of course not. Why would insurance cover it?
Why would they do that, right? I mean, they're not even going to cover our birth control anymore, so why would they cover that? They don't care about our vaginas.
That's a whole other conversation.
But it's a pretty phenomenal treatment option, and you know, I always say, it's not up to me to determine what it's worth to somebody.
Yeah.
To not be able to use your vagina versus to be able to use your vagina. There are also other non-hormonal medications that we can use for that chemically induced menopausal state that a lot of breast cancer patients or survivors are put into. There are non-hormonal therapies and pills that we can use to help with the hot flashes and the night sweats and the mood swings and all of that kind of stuff. But the vaginal health alone is, I won't say it's easy. It's not easy, but there are options, and there didn't used to be options.
That's very interesting. Like, I didn't know any of this. Like, it makes sense that, you know, going through the treatments for cancer affects your sexual health, but it's just the in-depth we're going is fascinating. You're right. Nobody ever thinks about the sexual health.
Right. Well, and then if you also think about say a woman has had a mastectomy and maybe not a rebuild, right? Not everyone has a rebuild, so they just have a scar.
Yeah.
And maybe they're okay with it, but oftentimes the partner is frightened. So that partner could be loving and caring and nurturing and not at all turned off by the fact that there's not a breast there, but frightened to touch it. They don't want to hurt them. They don't want them to feel self-conscious about it. So there's this unspoken divide that gets created just because of some of the body changes that can happen with the surgeries even. So the therapy for that can be very helpful too. So yeah, I think sexuality after cancer is a huge deal. When a relationship dissolves because of a lack of support or whatever it dissolves for, the studies actually show us that recurrence rates are higher when our support system dissolves.
That makes sense.
So we need sex therapists and sex counselors to help us work through these relationship issues that come up not only during treatment, but persist sometimes after treatment.
So what would be the tip for this week then?
If you're a cancer survivor or if you're going through cancer treatment, ask your provider, ask your oncologist, ask your surgeon, if you have a breast surgeon, who can I talk to? Because I'm feeling like my significant other, my partner and I are not seeing eye to eye, and I'm feeling our relationship, our sexual relationship, our intimate relationship slip away, and I don't want that to happen. Or maybe it's already slipped away. Can I save it? What can I do?
Yeah.
Just ask, because there are places that we can send people to help with all of that. Most women and girls will be affected by a cancer that affects their genital organs. Hopefully your providers are advocating for you, because that's what we're supposed to be doing. But if you feel like they're not, then absolutely ask. Don't be afraid to ask.
Yeah,
that's what we're there for.
It's your health.
It's your health. So. It's your boobs. You get to keep them if you want them.
And your vagina.
And your vagina. So let's take good care of them, because they're vital. So get your exams. Do your breast exams. Get your clinical breast exams. Do your mammograms. If you have a high family history risk, then get tested if you qualify. Get the genetic testing and find out what your risk is, because if you have a high risk based on your family history, if you have a genetic risk, then you qualify already for mammograms, MRIs, for earlier, more aggressive screening. And if we can find something earlier, then we're less likely to have problems later. That's my tip.
Okay, perfect.
Save the boobies.
Save the boobies!
And the vaginas. Save the vaginas.
Save the vaginas! That's perfect. You don't need a poster board, you just have the vagina pillow.